Hi, my name is Madison Chapman. I am an Education Outreach Liaison at Doylestown Hospital, and with me today is Dr. Asia Ahmad. Dr. Ahmad is a gastroenterologist with Doylestown Hospital and is a recent addition to the practice. Dr. Ahmad, can you please give us a brief description of your education, your background, and what you do at the hospital?
Thank you, Madison. I'm very happy to be here today. I'm, as you said, one of the gastroenterologists at Doylestown Health. I trained and worked at Drexel University College of Medicine in Center City, Philadelphia, and I'm thrilled to be working now at Doylestown Health. Our group consists of 8 other gastroenterologists and 3 nurse practitioners, and together we see almost everything that deals with gastroenterology and liver disease. We have offices at Doylestown Hospital, as well as in the Pavilion and at Wrightstown, and I'm excited to talk to you today about gut health during the holidays.
Thank you so much for sharing. So during this time, people tend to indulge in foods that they normally wouldn't eat during the year, and it can flare up some gut issues that people might not experience the rest of the year. So before we dive into that, let's just cover what is gut health.
So in order to understand what gut health is, you really have to understand what is the gastrointestinal tract. And I have a picture that pretty much outlines the entire GI tract, and I'm going to utilize my pointer if I can to try to show you. When you take in food, you eat and drink by chewing in your mouth. Your mouth, along with your pharyngeal muscles or your neck muscles, pass that food down into your esophagus or your swallowing tube. That swallowing tube takes your food below your chest level into your abdomen or your belly, and that's where you see your stomach. I have it right here highlighted. Your stomach will then expand or dilate in order to accommodate the food, and then it will churn it back and forth until it digests it into small pieces. Those small pieces go into the small intestine. Here's the small intestine. It's packed really tight in here. It actually is more than 25 feet of tube-like structure. And what it does is it absorbs nutrients and fluids, and this is the main organ for absorption and for your nutrition. And then any byproduct is passed into the colon. Here's the colon here, this long tube, and the colon then will turn any residual debris into solid stool, and then you will excrete it. The other thing to remember is that your body secretes its own natural fluids. So it's not just what you take in. Your stomach makes a liter of fluid, you have bile, your pancreas makes digestive enzymes. So together, your entire digestive tract is working in overdrive, and there's a lot of components going into your gut health.
So there seems to be a lot of moving parts with your GI tract. Going back to the holidays, so what are most common conditions that you see during the holidays?
So there's a lot of conditions you see during the holidays, especially with the GI tract. But if we start at the top, that's actually the most common. So when we look at patients or people that overindulge in the holidays and have large meals or eat foods that they don't typically eat, what they're going to experience then is gastroesophageal reflux disease. It's also called GERD. And what that is for those of you who don't know, the sensation is this burning or pain-like sensation at the bottom of your sternum, so right here. And then what it does is it travels up towards your jaw or into your mouth. And it can also be a sour taste in your mouth. People talk about water brash. It can also cause severe chest pain. Some of the atypical symptoms are actually just waking up in the morning feeling that you're hoarse or you're chronically coughing. Sometimes reflux can get in your nose and cause postnasal drip. So these are all symptoms of gastroesophageal reflux disease. And I have a picture here that shows you what exactly is the cause of when you're having reflux, like why does it occur? Well, you see at the bottom of that swallowing tube is a little tightening or narrowing. That's called your lower esophageal sphincter. It's the muscle that prevents food and any fluid your stomach makes from coming back into your swallowing tube. If for any reason that narrowing or that muscle is weak, you will see that food will come back up or liquid can come back up. Even eating a very large meal will distend your stomach and weaken that barrier. If you look on the right of this picture, you can see that there's something called hiatal hernia. Now, hiatal hernia isn't the most common, but when it occurs, it means that border or boundary between your chest and your belly, your abdomen, is becoming so weak that your stomach can actually bounce up into your chest. So what's the problem? Well, the problem is food and fluid made in the stomach is now actually can partially be in your chest. And if that occurs, you're going to be very predisposed to reflux, especially while you're lying flat.
Okay, that sounds very uncomfortable and probably a little painful. So are there any complications with that, and can it hurt?
Well, I'm going to actually show you some pictures so you can see how painful it can get. So one of the things that is, and I have an endoscopy picture for you if you want to take a look at this picture. The first thing is on the top left-hand corner, there is an esophagus. The esophagus right there, it looks smooth, it looks undamaged, and it looks open. But what happens when people have reflux that's uncontrolled, or they naturally may have a narrowing in their esophagus? Well, you'll see this ring-like structure, and in this bottom left-hand picture, you can see that there is this narrowing right in front of the bottom of it. And what happens is if you're taking in your large Thanksgiving meal, or you're used to eating a lot of bread and then drinking water, the bread will expand. Think of it this way, that meat or that bread will sit upon that narrowing and will cause what we call food impaction. And this is actually a common thing that happens during the Thanksgiving time when people are indulging in a lot of turkey and mashed potatoes and bread. So that's something that can be a potential complication. If you look at the bottom right-hand picture, you can see this is a person that has a narrowing and also has damage with ulceration or damage. You think of it as like a scrape in the swallowing tube, and that can occur again from ongoing damage. And lastly, a condition that's more common in younger people and generally in men, younger men, is something called eosinophilic esophagitis. That's the top right picture. What that is generally in people that have allergies to either foods or could be an environmental allergy. And what ends up happening is they develop what's called asthma of the esophagus. It's just like asthma. They're exposed to that allergen, and then their esophagus gets swollen and furrowed or narrowed. And those people will present after they have been exposed with those food impactions or going to the emergency room saying that they can't get their food out. So these are all potential complications of uncontrolled reflux or just having an underlying condition that someone may or may not know about.
So are there ways to prevent GERD and its complications that you mentioned?
So the easiest way is to stay away from things cause reflux. I mean, a lot of people know the typical foods for them. It's not always the normal foods. Some people reflux to things that are out of the ordinary. And if they do, they should stay away from those foods if they're having the typical symptoms. But there are others, and most people will reflux to very typical things. And here's a picture of a list of different foods and drinks that people generally reflux to. So the number one thing is tomato-based foods. So if you have your red sauce on pasta, or you're eating a lot of pizza during the holidays, or cooking with a lot of tomatoes, of course that is a trigger for the majority of people. But other things that are common during the holidays, you're drinking some alcohol and lying down, and it can be not just red wine. White wine is a big offender. You're drinking a lot of coffee or carbonated beverages. Carbonated beverages actually expand the stomach and then weaken that barrier for preventing reflux. Onions and garlic, unfortunately, some fried foods. Chocolate and peppermint are big ones, and unfortunately, a lot of the sweets over the holidays, especially your candy canes, are made of mints, and those are big offenders of reflux for a lot of people. But what can you do? You can eat smaller meals. You can try to avoid those foods. Avoid late night snacks. So if you were to just have a peppermint or a mint or just a small thing right before you were lying down for bed, that's a big no-no, because anything that you ingest right before you lie down will have a propensity of coming back up. Other things that you can do are use a wedge or elevate your head in a way so that by gravity, food does not come up, it goes down. And it's important that you don't just put pillows under your head. You have to actually raise your chest. And in this picture, you can see this is a crafty little pillow here. This pillow is not just raising this man's chest, but allowing his arm to slide under so he's comfortable while he's sleeping. And lastly, one of the big things, and we always laugh about it, is, oh yeah, I gotta loosen my belt buckle when while I'm eating a big meal. Well, it actually has been shown by actually medical studies that you should loosen your belt because it could increase pressure in your abdomen and actually will push food or liquids up into your chest if you've recently eaten a big meal. Other things, just remember to chew, chew, chew. If you have any problems with swallowing, make sure you chew your food good, or I'll be probably seeing you in the emergency room, which we both don't want to do, don't want to be in the holidays.
Okay, so you talked about the upper GI. What about anything that affects the colon?
Well, even before we get to the colon, we can go to the middle. So there's a top, there's a middle, and the bottom, and the small intestine. We can go to that, where that's your small intestine is the 25-foot organ that actually absorbs nutrients and absorbs fluids. Anytime there is an issue with digestion where someone has a food intolerance or they can't digest an enzyme, digest a food due to an enzyme deficiency, they will get bloating, they could get diarrhea, they will be gassy and have flatulence, their stomach is distended. All of these things are known during the holidays because people just can't help eating some of the foods that they may be intolerant to. So the first thing that is an actual disorder is something called celiac disease. That is an immune reaction to gluten. And I have to say that celiac disease isn't as common as just pure old gluten sensitivity, so keep that in mind. Some people are just sensitive. But if someone were to have celiac disease, just to give you some background, the body produces an immune reaction anytime it's exposed to gluten. And that immune reaction goes and actually damages the small intestine villi, or those little finger-like projections in this picture that help the actual absorption process. So that's why people with celiac disease can't actually absorb a lot of nutrients. But again, people with gluten sensitivity have the same problem. What I do want to tell you during the holidays is that a lot of times there is gluten in a lot of the foods that we eat, and it's snuck in with condiments or other additives. So for example, I think of a lot of gravies, maybe some gravies are made with bouillon cubes, I don't know, but bouillon cubes have gluten in them, soy sauce, ketchup, beer, some vodkas. There's a lot of different foods that you wouldn't normally think have wheat or gluten in them that people that are either gluten sensitive or have celiac will be exposed to and then get these symptoms. So it's good to really, if you're sensitive, you got to really read labels to really understand what is in some of the foods you're eating, or ask whoever's cooking, like what did they really put in there. The other thing that's very common during the holidays is bloating due to other issues or other foods. And there's so many foods that people are sensitive to that you can't name them all. I would say the most common is people that are lactose intolerant or have issues with dairy. And of course, there's milk and cheese and yogurts, and there's different things in a lot of the foods we eat. I would tell you that milk on its own is the number one. It has the most lactose in it when you look at amounts of lactose. So one of the tidbits I would tell you is that if you could substitute dairy or animal milks for non-animal milks such as oat or coconut or almond, that will really alleviate the symptoms of people who have lactose intolerance. The other type of food food type that people are very sensitive to are fructose or fruit juices or corn syrup. those are in a group by itself where people should really be careful, because a lot of people are fructose intolerant. So they're very sensitive to corn syrups or certain fruits and fruit juices. Some of the other ones, they're too hard to remember, but here is a list of a bunch of the most common offenders, and they're all, if you want to know what FODMAPs, so it says here, eliminate foods that containing FODMAPs. FODMAPs are really an acronym for those types of foods that are short-chain carbohydrates that the small intestine does not absorb well. So again, you cannot memorize it. You couldn't figure it out just by having a list. You really got to do some investigation and be very careful. If the same type of food is causing GI symptoms again and again, there's likely something in them that is causing your symptoms.
All right, so now what affects the colon?
Now let's get to the colon at the bottom. And so the colon is, as you recall, the organ of the GI tract that now is composing the stool or getting all the excess debris from your GI tract, forming it into stool, and then excreting it out of the body. The colon has a very important function, and a lot of people will suffer from constipation during the holidays. I mean, I think a lot of it is based on the foods they're eating, changing the diet, not eating what they're really used to eating. Constipation can be threefold, so it's important to know that there's different subtypes of constipation. There's your general constipation called colonic inertia, where your colon moves slowly. Most people know they have this type of constipation because during the year they're always constipated, they're bloated, they have reflux, their whole GI tract moves sort of slowly. And then there's those people that have constipation based on irritable bowel. So they're just, when they get stressed out or nervous, maybe they're cooking for the holiday meal and they're nervous, they will get constipation based on that. But the most common type of constipation is based on issues with the pelvic floor. And there was a very nice previous segment on pelvic floor dysfunction by Dr. Soriano. He covered it very well. And what his take home is that the muscles of the pelvic floor are very important for a wide variety of functions throughout the body, but one of them is for excreting stool. Those people that have pelvic floor issues or their pelvic floor is tight will have problems, especially when they're not eating well. I have a picture just to show you, just to highlight how we were centuries ago. So on the top is a man, maybe in 1700s, that was sitting, trying to have a bowel movement, squatting over a makeshift toilet in the ground. This is the normal, proper way to have a bowel movement. You have to relax your pelvic floor muscles. So you have to squat in a position that allows you to evacuate. So what happened? Why did things change? Actually, the reason it changed is because of the cholera epidemic. And they realized back in London that there was a water pump that was actually carrying the cholera. It was like a big epidemiological study. And from then, that was like the hallmark of when sanitation occurred. And from then is when they realized they had to fix the toilets and make sure they were more sanitary. So what happened, we have now toilets that are above ground that this gentleman here on the left sits on in, reclined back, reading, sort of bored. Things that we may do naturally, but maybe we do more during the holidays. So this is not a correct position, and it really predisposes to pelvic floor dysfunction and constipation. So what can you do? Well, if you look on the right, there is a toilet that has a stool on the bottom. It's a stool that's created in a really fancy way that goes around the toilet. Some of you may know of it as the squatty potty, which was made famous through Shark Tank. And I wish I had created it because I knew about it. I'd be a millionaire and wouldn't be talking to you right now, a billionaire. But anyway, so what you do is when you're having a bowel movement, you sit on your toilet, but you put your feet up on this stool and you lean forward. And what happens is it sort of simulates how you naturally should be sitting on a toilet or the natural position of trying to have a bowel movement. And this will help someone evacuate. It's something you don't need to go out and buy. You can actually use a bunch of books or a stool or anything at home and utilize that just to get this appropriate position. So that could actually help. That's like something you don't even have to go to the store for. It's like an easy fix.
Right.
The other thing that happens a lot during the holidays with the colon is something called diverticulitis. So people have heard a lot about diverticula. It's very common. I mean, by the time you're 80, 80% of people or more have it. So people start developing it in their 30s and 40s. And what it is, it's little out pouches in the colon that occur because the colon is working really hard to try to evacuate stool. So if the stool is not bulked up appropriately, the colon's working like a muscle and pushing, and there's certain areas of the colon that are very weak. And when they're weak, they develop these little pouches, like just little protrusions. And in this picture I have here, I can show you that they're on the left side of the colon is the area that generally has the most problems or develops the most diverticula, so it's simple. But what people often get confused is what diverticulitis is. That's when one of them gets infected. And why would they get infected? Well, if the stool just happens to sit in that area, or if someone has been eating some naughty foods that cause diverticulitis, and they're really like holiday foods a little bit. There's like a lot of the nuts and popcorn, like maybe if you get like candy corn, those little, what are they called? What are those little Cracker Jack kind of popcorn kind of things? So you get that, or you get nuts, or you eat little seeds. They can get trapped in these diverticula, and what happens is when they get blocked up, they create an infection and it becomes like a pus pocket. It sounds pretty, doesn't sound friendly, but I don't think people should worry that they're having this on a normal basis. People that have diverticulitis will have severe pain. They may have a fever. They get severely constipated. They generally are in a lot of pain where they feel like they have to go to the hospital. So it's not something, just a little bit of tenderness would not be diverticulitis. So be careful during the holidays about your little nuts or popcorn and seeds, especially if you have a lot of these pouches, which you would know if you've had a colonoscopy. If you have a colonoscopy, generally it will be on your report. So that's pretty much the two things that happen with the colon.
So now that we know all of these conditions that could happen to you, how can someone avoid experiencing any of these symptoms during the holidays and year-round?
So a lot of it is common sense. And a lot of it is, okay, you're seeing that big meal, try not to eat it all at once. That's easier said than done. I mean, at Thanksgiving, for example, people tend to eat a large meal, and, so they'll know they'll be bloated, or they may have some indigestion. But in general, try to eat smaller meals, smaller, less heavy meals, chew your food well. Try to stay in your routine. So if you're used to exercising, drinking water, don't get out of that routine and try to stick to a schedule. Most people find this difficult, but they can they do it for the most part, and during the major holiday meals, we'll deviate from it. But most people will always want to indulge. And I just have another little tidbit for everybody here, because sometimes people say, listen, I will never stop binging on food, and I like my big meals, and I really don't want to have those symptoms even for 1 or 2 days. So what can I do? Well, there's one person that's definitely mastered this. And you can see just by his picture, you probably know who he is. He's Joey Chestnut. He is the hot dog champion. He's just broken his own record and eaten 76 hot dogs and buns in 10 minutes. And so, he does this because he exercises his jaw. He trains like a marathon. He knows how to, train so that his stomach expands for large meals, and he can do that by this training. Then over time, he can learn to accommodate and do this. So if you're that into eating your big meals without any distension or discomfort, he's the man to read about it and talk to. But otherwise, it's the simple things that are important.
Right, and with the holidays, it gets hectic. You kind of forget your normal schedule sometimes. So Are there any of these like over-the-counter medicines? You see a whole aisle of over-the-counter medicines. What are some that someone can use if they have any issues?
So there are a lot of over-the-counter medications, and for the most part, they're sufficient. You don't necessarily need anything that is, a prescription to solve any of the minor issues that people have over the holidays. If you want to start from the top or where we started with reflux. And in reflux, most people will have it based on one big meal. So they have one big meal, and then they have reflux, and they don't know how to calm down that one episode. This is the time where you just go for your general, what's called H2 blocker, which is something like famotidine or Pepcid. Though that medication works on demand, you can be taken as needed, right then and there, and has a pretty good immediate effect. Other things that can be taken, Tums, very simple. You can take apple cider vinegar, works for some people, helps with digestion. Other things, Gaviscon will help as well. So these are the over-the-counter medications that can be taken on demand. But what happens if you've been having that, you're at the holidays having these big meals for multiple days, and you're having like a week, or you're having multiple days of these symptoms? That's when you can turn to your over-the-counter Prilosec, which is omeprazole, esomeprazole, you've heard of pantoprazole. All of these medicines are something called proton pump inhibitors. And they need to be taken on a regular basis, has to be a half an hour before a meal, the same time each day. It builds up in a person's system and allows there to be less production of acid. So this could be taken for a 2-week course, just to take care of a flare. And so that would be your next step if you're having the symptoms, the upper GI symptoms, your GERD-like symptoms for more than a day. Then if you want to move on to the discomfort, someone feels very bloated or they feel uncomfortable in their top of their belly, that's when you would move on to your Pepto-Bismol, for example. Pepto-Bismol is a bismuth-like product. It will help you with nausea, bloating, diarrhea. It even will help you if you have an infection, because it actually helps with toxin reduction. So some people will take it when they're getting traveler's diarrhea. So they're going out, going to other countries, and they think they're gonna catch an infection, like they wanna prevent that. The one thing to remember with Pepto-Bismol is it will turn your stool black or dark. And so do not be worried and run right to the doctor that, oh my gosh, I'm bleeding. It's an expected thing from Pepto-Bismol. The next medication for which I really like, which is over the counter, is something called FD-GARD. FD stands for functional dyspepsia, which is basically saying your stomach hurts. And it is a menthol and a caraway oil. It's a natural medication that helps prevent this nausea and bloated or upper belly discomfort. Other things you can take are just ginger. There's some natural things you can take that will help prevent this nausea that people may get. If you move down into the small intestine, this is where we're really dealing with irritable bowel. So people are having like spasms or cramping-like sensations. I really like IB-GARD. IB is in boy. And IB-GARD is irritable bowel. That's what the I and B stand for. And it's an encapsulated peppermint. That peppermint is known to reduce contractions of the small intestine. It's very good for cramps. And someone may say, I just said do not take peppermint during the holidays because it will cause reflux, but IB-GARD is encapsulated. So what that means is it does not release until it reaches the intestine. So it does not have the risk of reflux. And lastly, for those people that have the constipation or have diverticula and want to prevent diverticulitis during the holidays, a good thing to do is to really make sure you take your fiber supplement. Fiber supplements there's a wide range of them. I just put one up here, but they go by a lot of different names. They are also in different formulations for people who'd rather take gummies or wafers or powder. It helps bulk up stool, helps move stool through the colon. It prevents or helps prevent diverticulitis. It really helps with hemorrhoidal bleeding because it helps pass stool so it doesn't sit by the anal canal. So for those people that are getting hemorrhoids from straining from the constipation, fiber supplementation really is an easy and good way to help with the lower GI tract.
So if all of those medicines don't work, they're experiencing these symptoms constantly, when would be that time to say, okay, I need to call somebody?
Well, really, the big thing is to look for really what we call worrisome symptoms or warning symptoms. If you start bleeding uncontrollably, if you are experiencing weight loss because of these symptoms, if you're having problems with ongoing swallowing, or your symptoms just don't seem right for when you naturally maybe binge on food or have these holiday foods, that's the right time to speak with either your primary physician or to get in touch with us in gastroenterology for further evaluation.
Okay, so we have covered a lot today. So what is something that you want the viewers to take away today for the holidays?
I think just take away that everyone really experiences some GI distress during the holidays if they indulge in things they normally don't indulge in, and if they eat foods that they know will normally, cause some GI distress, and not to really worry about that. There are some modifications, and even if you can make one or two modifications, such as eating just a little bit less, or just, chewing your food well, or just, trying to drink more water, or continue with your exercise pattern. These are little things that may, in the long run, alleviate your need for going for over-the-counter medication. So just the little things, and a lot of it is common sense. I think we all know what really does it for us. So that's really my take-home message for everyone out there.
Well, great. Thank you so much for joining me today, and happy holidays, everyone.
Happy holidays.